Thank you, Stephanie. So, like Stephanie said, I'm the director of programs for the Alzheimer's Association, Greater Kentucky and Southern Indiana. And my internet's been a little wonky this morning. So, if you can't hear me, hopefully Stephanie or Heather or Dr. Hart can um, put a note in the chat or whatever is easiest. What director of programs means for the association is I am the director of the care and support pillar of Greater Kentucky and Southern Indiana. And I will share my screen. So today I'm just going to talk a little bit about our resources at the association, how you can access them. The Alzheimer's Association leads the way to end Alzheimer's and all related dementias by accelerating global research, driving risk reduction, early detection, and maximizing quality care and support. And you'll see that our association has many different pillars to engage families. We do have 78 chapters nationwide. For every dollar that is raised, 78 cents funds our mission. And then here locally, we have 11 staff serving 125 counties through Kentucky and Southern Indiana. And so we know that we need to be in communities throughout the state. So we are located in Bowling Green, E-Town. So we are, again, spread out in different counties throughout Kentucky. That way we can better serve our community. So again, today I'm just going to talk a little bit about the resources at the association, how you can access them. Uh, I always talk about our 24/7 helpline because we know that caregiving isn't 9 to 5. You can call this number. I know it's a 1-800 number. Stephanie's heard me say this multiple times, is that I know sometimes you think of an 800 number and you're like, well, who am I going to be calling? How many numbers am I going to have to push to get to the person that I need to get to? And so this is housed by our organization. It is not by a third party. It is housed by master level clinicians. So if you need to call to get an action plan, once you get a diagnosis or you're having some memory issues or your loved one is, you have a lot of questions. There's a lot of boxes to check, or you just need to know what to do next. You can call this number. You can also call this number if you need information about a power of attorney or to find a local support group in your area. So again, this is not for emergencies. This is for anyone at any time, even if you just need someone to talk to at 2 o'clock in the morning on Christmas Eve. So we also have 28 support groups throughout the state of Kentucky and Southern Indiana. Free education programs. This is in person and virtually. Again, we know that sometimes the in-person programming can be a little difficult, especially if your loved one's having a bad day. As a past caregiver, I know my grandmother, when she was having a bad day, we weren't going anywhere. So we do make sure that everything's accessible in person or virtually. We have early stage support groups. We know that, we were talking about earlier, upon a diagnosis, there's a lot to learn. So this support group is very unique because the person with the disease and the care partner come together, but then they separate in separate groups. So that way they can talk freely, talk about some of the challenges maybe they're facing. And again, it's just a way to get answers, but also relate to people that are going through the same journey as you. We have social engagement programs. We know that this disease can be very isolating, unfortunately. And, there's still memories to be made. There's still fun to be had. And so we do have social engagement programs. We have one in Lexington called Memory Cafe, where they have recently they had the Transy Chorus come out and sing Disney music. They had March Madness trivia. And then we also have one at we call it Memories at the Museum at the Speed Art Museum. And so this is completely free for your family, your loved ones, and the person living with the disease. We also have the Caregiver Online Center, and I'll talk a little bit about that here in a few minutes. And then we also are active in professional development and resources. So this slide is a lot. And so this information will be sent to you, as Stephanie said, for anyone that's been registered. So there's only a few things that I'm going to point out that you could take note of. But again, this will be sent out, so don't feel like you have to remember everything on this slide. But our community resource finder, you'll see down at the bottom at alz.org/CRF. This is a comprehensive database for local dementia and age-relating resources. So if you're looking for a support group, if you're looking for an education program, maybe you're looking for in-home care to help with some respite. All this information is by zip code. So even if you're caring for someone from afar, you can look up resources in their area. So you live in Kentucky and you're looking for a diagnostic center in Florida, you can go to the CRF. Another thing, the Alls Navigator, it's an incredible online tool that is a personalized care plan for you. So if you're having questions about maybe my loved one doesn't need to drive anymore, you can go onto this website and you pick different topics. And so say it was driving, you answer a few questions that are related to your situation, and it pops out an action plan specific to you. So again, this is a really nice very easy to use tool that's online. It goes from doctor's appointments to finances to driving. So again, a great tool to have in your toolbox. Caregiver support. We know that caregivers are on the front line. Statistically, and research show that a lot of times caregivers are at risk because they're taking care of their loved one and not taking care of themselves as much. So we make sure that we wrap our arms around caregivers to ensure that they have the support and the guidance they need throughout this journey. So we do have a caregiver specific webpage that talks anything from what to expect through the different stages of the disease, where to get support, what does that support look like in their community, through the Alzheimer's Association, through some of our community partners like Norton, daily care. What does your daily life look like, especially as the person is navigating or going through the different stages of the disease, and then care options and planning. The sooner you can plan, the better. We always say, I know that you think about that's a tomorrow issue and that's a tomorrow issue, but we know the sooner that you start making those plans for care options, but also financial planning is incredibly important. And at the end of the day, it will reduce some of those anxieties that you have because those things are taken care of. So you can concentrate on today. This is one of my favorite resources that the Alzheimer's Association offers. Oop, and so it's called Publications. And this again will be sent to you. And I think this is a timing slide, so it'll probably change again. But all these are printable PDFs. So anything from safety to what to ask your doctor when you go to visit them if you're feeling like you're having some issues with your memory or your loved one is, financial planning, what is Alzheimer's and dementia. So this is really nice that you can print these out. Also share that with your family. We know the more you talk about this disease and have an understanding of this disease, the easier your time will be. So again, this is printable PDFs and anything from bathing to safety. And I use these every day. The Alzheimer's Association, as I mentioned earlier, does provide free programming. All of our resources at the association are completely free. We do have a new Empowered Caregiver series, and it is about person-centered care, and it was reviewed by over 400 caregivers, and it really takes you through the journey of caregiving. From the beginning stages of building that foundation of caregiving to exploring care and support services. Again, all these are completely free. I know when I wish I would have known then what I know now when we talk about communication and different behaviors with your loved one, and really understanding what the disease does to the brain so you can live in that person's reality. And so understanding some of these tips and strategies can really help you as you navigate the disease. And so we know that, like I talked about earlier, we have 28 support groups throughout the state of Kentucky and Southern Indiana. This is more of the Louisville area, but if you don't live in the Louisville area, again, you can go to our CRF and find that we find a support group near you through your zip code. But we do have a special program beyond just the early stage program that's very unique. But we do have a support group that's online that's specific to spouses. we know that a spouse's journey through this disease is going to look a little different than a grandchild or a child. And so some of those intimacy conversations and things like that, this program is specific just for spouses and care partners. It's a great group. Jenny Luffman is the facilitator. And just to note, all of our facilitators for our support groups are trained by the association and are either past caregivers or work in the aging space. But Jenny's great. She's actually a trained counselor. And so this is a very successful support group and very unique to where it caters more to the spouses and care partners. So just upcoming, I know Stephanie mentioned this is the very first part of our three-part series. And so the next one will be on May 7th, and that's updates from the field of dementia. This space is changing very quickly in a hopeful way. And so Dr. Cooper will be talking about some of those updates. And then on June 11th, we'll be talking about the impact of Alzheimer's and dementia in our community. And if you're interested, I know I talked about our new Empowered Caregiver Program. We do have two left, and that is partnered with the Department of Aging and Independent Living. And so the last two are May 21st and July 23rd. And I say that because you can take these, it is a series, but they can also be viewed individually as well. So if you missed a couple of the first ones, that's completely fine. I do encourage you to register. And finally, I talked about all of our resources being completely free, our 24/7 helpline, any resource you receive from us, education, support groups, again, are free. And that's because of our Walk to End Alzheimer's and our Longest Day. These are our two largest fundraisers. Our walk is actually the largest fundraiser for Alzheimer's in the world. And so, again, whenever I was a caregiver, I felt there was a way to celebrate my grandmother because we know that this disease isn't always sunshine and rainbows. But I wanted a way for our family to come together and really celebrate my grandmother, the life that she had, who she was. And it really became more of a like a family event. We did a cookout, we made t-shirts. And a lot of times this is the first entry point of a lot of our caregivers and volunteers, because sometimes if you think about a support group or an education program, they're more of an intimate setting. And so sometimes that can be a little, some people feel a little intimidated by, joining those at first, but also know that at our walks, there's resources at your fingertips. So when I was talking about, there's a lot of boxes to check. Well, if our walks, we have a lot of our community partners there, so you can come that day and talk to them. No more phone calls. You have the resources at your fingertips. NNI has been part of it last year, and we have over 1,000 attendees. And so it's just a great opportunity to learn more about the association and also celebrate your loved one. And I know I have a question slide up here, but I think that we will be taking questions at the end. So I will turn it over to Dr. Hart.
Awesome. If I can jump in, I want to do a quick intro, but just like Erin said, and Erin, thank you always for sharing that information. And like she said, we will send out a link, and I also put it in the chat function to explore their website, check out ours, but all of the information that Erin mentioned, I know we all use it in our practice as well, and it's just incredibly invaluable. So thanks, Erin. All right, so now to Dr. Hart, we're grateful she's spending her time with us this morning. So Dr. Hart is a board certified geriatrician with specialized training in memory and she's here at Norton Neuroscience Institute's Memory Center. She graduated from medical school from the Ohio University Heritage College of Osteopathic Medicine. And she completed internal medicine residency at the Christ Hospital in Cincinnati, Ohio, and completed her geriatric medicine fellowship at the University of Cincinnati, the Christ Hospital program. As a geriatrician, she has training in caring for older adults in the settings of outpatient geriatric assessments, inpatient consults, geriatric rehab, long-term care, and geriatric house calls. So again, we're very grateful to have you here today, Dr. Hart. So I will let you take it away.
Okay, thank you. Let me get my screen up here. I'll share that.
And while you're doing that, I'll just remind everybody the Q&A function down below. Please utilize that, and we'll get to your questions live on here at the end of her presentation.
Okay. All right.
Awesome. We can see it. Looks good.
Thank you. Thank you. Thank you for joining us this morning. Today's topic, like Stephanie said, is going to be changes in decision-making abilities and just ways on how we can protect our loved ones. This one's going to focus a little bit more on kind of risks that an individual with dementia would have as far as falling victim to financial scams, but what kind of approaches you can use to protect yourself and your loved one who lives with dementia. So hopefully by the end of today's presentation, we'll be able to identify some changes in cognition caused by dementia that impact that individual's risk for financial exploitation, list examples of financial scams, what that means, develop a plan to protect a loved one from being a victim, and then also discuss how financial vulnerability may actually be an early sign of Alzheimer's disease. So first of all, just some statistics. Estimated yearly losses for older adults just in the United States, how much they lose to scams every year, ranges anywhere from $3 billion to $36 billion. And there's such a wide range because we also know that a lot of older adults who are victims to scam actually never get reported. Since 2020, so actually since just the COVID-19 pandemic, elder financial abuse has risen 10%, and now there's more than 8.68 million cases per year. And again, these are just the cases that are actually reported. And studies show that actually only 1 in every 23.5 incidences of elder fraud are actually reported to the authorities. So it's quite common, and sometimes we don't know that this is happening because we don't ask the question. But why would individuals with dementia be at higher risk for financial exploitation? Well, first of all, just being a senior citizen makes a lot of individuals a target for financial scam. So we think about older adults having more health concerns. Their declining health makes them more vulnerable. We think about, decreased cognition, ability to think and remember, but also these individuals are more likely to have hearing impairment, vision impairment, poor mobility. They're often homebound, or they're often very stressed or very difficult to get out of the house without walkers, wheelchairs. They depend on other people for assistance. A lot of older adults live alone, or they live far away from children, out of town, or maybe out of state. So when they're feeling alone or feeling lonely, they depend on other people to help them. That could be depending on a housekeeper, depending on someone to come and fix plumbing, electrical sockets, hired caregiver into the home. But when they depend on these people, they can often readily trust them with things that they should not be. And people often think that they typically have a high net worth. They have retirement, they're no longer working, so there's money set aside for them. And most of our older adults do not have a lot of skill with technology. So if we think about how many phishing emails are sent every day, how many phone calls we get requesting money be sent to a fund or to something that we owe money for, like a toll bridge. If older adults don't have access or the skills to know what this technology is, they're more likely to think that they're real. And then the other important fact is that we need to understand that dementia is more than memory loss. I think the majority of people that come to our clinic, their primary concern from family is that they're just forgetful. They repeat things. They can't remember something I told them. And I think we get this misconception that dementia is just short-term memory loss, but dementia's effects expand throughout the brain. So there's a lot of changes in thinking, and that can be things like difficulty communicating. A lot of these individuals have trouble speaking, maybe writing out their thoughts or their needs for communication. They have a lot of challenges with planning and problem solving. Short-term memory loss means that I see the here and now. I don't know, or I can't process what those consequences of a bad decision might be. We think about how often things are misplaced, how many Medicare cards, identity cards are lost. And when we have dementia, we're not able to really retrace our steps easily to find those. These individuals can have problems with visual and spatial identification and comprehension, and they have a really large amount of decrease in judgment skills. So again, thinking about an older adult living alone and needing to depend on someone like a caregiver or like even just a handyman, would they be more likely to trust them with things like more money or with things, being in and out of their house, keys and things that if their judgment or their cognition was normal, that they wouldn't do that for. And they often have confusion with time or place and difficulty completing tasks. And dementia does impair reasoning for individuals. So it affects a person's ability to make decisions. And so this makes individuals specifically with Alzheimer's disease very vulnerable to financial scams. Their judgment is impaired, their decision making is not intact, and it makes them very easy targets for exploitation. If we think about the cognitive functions with Alzheimer's disease, Alzheimer's affects the regions of the brain we need for memory, for decision making, and even financial management. So for these individuals who have a hard time with problem solving or future thinking, it's hard to assess the risks, but also make sound financial decisions. And so because of this increased vulnerability, often we struggle with managing money and assessing risks, and again, making them more susceptible to scams. And I put this slide on here because I think it is an important education piece. I try to always make sure that I go over with a family and care partner when we have a new diagnosis of Alzheimer's, is that really when we think about all of those changes in the brain, this individual with Alzheimer's disease really needs to have a caregiver or care partner start assisting with these 4 big areas: medications, meals, mobility, and money. And medications, if we're looking at some of these simple things that we could do, are we organizing medicines? Are we attending medical appointments? Are we scheduling them for these individuals? Are we making sure we're getting to the grocery? We're getting meals dropped off or delivered? Are we driving safely? But a big component of money really means that a care partner needs to start knowing how much money and how much money an individual has, but also how much money is coming into the house and how much is going out. So some way to start monitoring accounts, being on a bank account, even getting electronic statements so that we know, again, visually can see how much money is coming out of accounts. And it's really important when a diagnosis is made to go ahead and set up a financial power of attorney. So what are some examples of financial scams? Probably anything that you can think of, it's probably happened. But some of the most common ones are listed. So charitable donations. There are legitimate charities and there are illegitimate charities. I know I gave money last year during Easter to a charity in the Catholic Church, and ever since then, every week, now I have 5 different agencies that send me a request for money just about every week. Having intact cognition, I can see that, every week is a little bit excessive for somebody requesting money, so I can throw those out. But think about an older adult, when we have difficulty remembering, we can't remember which charities we gave money to. We don't remember which charity requested money last month. And then we have to think about, well, how much money should we give and how frequently should we give them money? And those are just for donations to charities that are legitimate. But there are also a lot of illegitimate charities disguising and requesting money as well. But impaired judgment means that someone needs help recognizing when to stop donating money, because we also have to think about they need the money to pay for their own needs. And then another common example that I hear about often is the paid caregiver. So again, a lot of these older adults with dementia live alone. The reality of the world is that caregivers often still have to work. They still have to have other family members they care for. They have house payments and other things. So often a caregiver is hired to help assist an older adult with dementia. But as a true case, there was a paid caregiver of an 80-year-old woman. This woman ended up stealing her personal information, including her social security number, as well as balance transfer checks from her mail. So the caregiver started writing checks to herself, which meant that she then took out a fraudulent loan for thousands of dollars, again, against this woman's credit card limit. And then after a while, the unusual charges led her son to check her credit report. He discovered loans and credit cards with her name on them with balances of tens of thousands of dollars for each account. And ironically or sadly, this was a true case of the person who ended up becoming the maker of the Norton and Norton LifeLock identity theft protection. And then another common example is social media accounts and fake celebrity social media accounts. I think, again, thinking about technology limitations or technology skills limitations for older adults, our kindergarten, our high school students, all of them know what Twitter, X, Facebook, Snapchat, all of those things are, but older adults get on the internet and not knowing how some of these social media accounts work, the monitoring the people who can claim to be someone who's not. But a 74-year-old woman has sent text messages, exchanges with people who she believed were her favorite country star singer, Vince Gill, and his associates. It began when he went on tour and she saw his page on Instagram and left a message that, "I hope you come to Boston where I live." So multiple scammers saw this. They started reaching out to her, pretending that they were Vince Gill, his daughter, or his manager, requesting to connect with him on a private chat. By the time her daughter discovered the fraud, she had sent them over $400,000. Then I think probably a common example, again, that's becoming more prevalent is the family call, cell phone call or cell phone text message about a family emergency. So an example, someone sends a call or text message, "Hi, Grandpa, it's me." It's a male speaking to an older gentleman, and he says, "Sebastian, is that you?" "Yes, it's me, Sebastian. Grandpa, I'm in trouble, and I need money for bail." "Oh no, what happened?" "Please don't tell Mom or Dad. I'll get in so much trouble, but please help me." And it's very sad because most grandparents are going to want to help a grandchild. And if they think they're in trouble, their instinct is to try to help them immediately. They need money, they need a ride. "I'll show up, I'll get this for you." But when we have cognitive issues or memory issues, for them, they respond in an emergency instead of slowing down to verify this information. And the problem is that scammers are very convincing. Especially when scammers are calling like this emergency cell phone call. The scammers know a lot about you. They can find out a name, an address. They can find out information about family. Sometimes that information can be found on social media. Sometimes it's email hacking. But unfortunately, there are a lot of public records information that's just available through Google or Bing search engines. If you put in the name of someone living in Louisville, Kentucky, you can get a list of all the people who have that name, what their age is, and where they live very easily. A lot of scammers also use very triggering language. "We need to pay right away." They'll use information like wiring money through Western Union, sending a cryptocurrency, a payment app. And also, again, for older adults not savvy to technology, these can be very difficult to manage. So a lot of individual scammers will say, "We'll put money on a gift card and mail it to me." And then also scammers can pretend to be authority figures. Scammers can call as fake lawyers, a fake police officer, fake doctor working with a family member. And then some scammers even use artificial intelligence and they clone a loved one's voice. So thinking about, again, someone getting a phone call about a distressed grandson or granddaughter, If there's a short audio clip that sounds like their loved one's voice, they're going to be more likely to try to reach out quickly to give them that money. And some common themes in these are fake emergency scams. It's urgent. I need it now. You're the only one who can help. And so again, an older adult, grandparent wanting to help someone in their family, this information is this language is very triggering and they want to do it now. They also, as a scammer, will talk about keeping it a secret. They don't want you telling other family members. Don't tell mom and dad, I'm going to be in so much trouble. And they'll play with emotions. They're counting on you to act fast to help family, and they're counting on you to pay without stopping to confirm that it's an emergency. And this is where I think education can be a really big help, because if somebody does get a call like this and we can identify this is a bad call, call someone else, if it's a grandchild supposedly on the phone, can you call an adult daughter, an adult son, find out where they are. And then next, how do we protect individuals with dementia from these financial scams? And probably the very best scenario is that we need to have the ability to work on prevention instead of responding to an emergency. So thinking again about, keeping contact information updated. Grandparents especially should have family members' phone numbers on hand so they can easily and quickly reach out to verify a story. I know when my grandparents were living, they were not cell phone people by any means, but both sets kept a sheet right by the phone number, and it had their kids and all of their grandkids' cell phone numbers. And my grandmother told me once, well, if I get somebody calling and telling me they're you, I'm going to look down and make sure that that's the number on my caller ID. So that could make a big help for someone. Also increase your financial literacy. And if you have a loved one who has mild dementia or mild cognitive impairment, that might be something that you all can work on together. There are a lot of courses at community colleges, senior centers in Louisville. Our Louisville Public Library will host these sometimes. Books, articles, anything you can understand about money management. And then seniors who are more financially literate have shown better structural and functional connections in the brain. So that can be protective. Also stay alert about the latest senior scams. Anything that is prevalent, probably in the last 2 to 3 years, the gift card scenario where you can't send money through cryptocurrency or through a payment app, put it on you put $500 on a Visa gift card and send it to me. That became very prevalent. It was reported to the National Center on Elder Abuse, so you can access their website to identify what are the latest scams. Are there any new ones that we should be aware of or looking for? Also be open about the finances. It's important to discuss what bills an older adult has and what they're spending every month. Not that they shouldn't spend money at all, but we should identify are the right amounts of money being utilized for bills and being utilized for personal expenses, considering how much money someone might have in their account. And then a big piece is keep track of workers. Again, when older adults live on their own, how many times do we have to call a plumber? Would we have to call an electrician? We recently had a lot of storms, flooding in Louisville. Are there people that you're needing to call to check your roof, to help get water out of the basement? So if there are workers that are coming to the family or to a older adult's home, make sure that these elder parents have a trusted vetted list of workers so that they don't find themselves, again, slapped with a bill that has spiraled out of control, or someone that comes into their home and may actually take things or steal things from them. And then for the individual that we're concerned about, watch for any changes in memory or math skills. These are usually red flags for the likelihood of them being vulnerable to this financial exploitation. And then next off, how do we protect a loved one from fraud? So secure all personal documents in the home. So if there is a financial power of attorney, if there is a will, all of those documents should be kept in the same place. They should be kept maybe in a safe or a lockbox. And then your financial power of attorney should also have copies of those. You can also set up something called unusual activity alerts. So if you have a bank or a checking account, debit account, credit account, your electronic activity, you can set up alerts to a cell phone text message or to an email message if something unusual happens, something that is concerning for fraudulent activity, maybe a large withdrawal that would not be expected. You also can ask to receive copies of their bank statements. So much now is done electronically that even if an older adult is still going to their bank and doing most of their day-to-day activities or monthly activities with the teller, having an electronic bank statement can make a big difference for a family member, again, to see if there's anything unusual about any spending. And then consider using a service that can identify a potential fraud. And there are tons of them out there. And again, with someone who has cognitive impairment, we need to make sure that a loved one looks through this service to make sure that it is a vetted service and a legitimate one. But Norton LifeLock, Identity Guard, Aura are some of the most common ones. You can also ask to be the trusted contact at their financial firm. I know a lot of people that we get in our office, especially outside of the Louisville area, they may know and have gone to the same bank for 50 years and their entire family goes there. So they may actually be able to be the contact for some of the banking issues that are done. You can also help them identify how to freeze their credit report, meaning that while their report is frozen, no one can open a credit account in their name. And then you also can help set up robocalling blocking or text messaging blocking. Again, thinking about someone who doesn't have a lot of technology skills, maybe as a young adult or teenager would, there are a lot of options you have now on smartphones where you can block unwanted messages or calls. And then as a caregiver, again, thinking about what are the most practical interventions, helping setting up online banking. Automated bill pay is very helpful for individuals who live with dementia because that way we know if they're in their home, they have cable bills, electricity, phone bills, things that we know that need to be paid for to maintain their ability to live there. They're taken out every month, no matter what. A lot of people will set up a joint bank account or at least a bank account where a family member has access to it or has their name on it. They can set up overdraft protection and they can also set up like spend limits each day. So again, thinking about if a scammer is going to take out a large amount of money, $5,000 or something at a time would not be something that this individual would typically do. You can set maybe no more than $2,000 out at a time or per day. And then a lot of people will also start working with an elder law attorney to set up a living trust. And I think it is important early on in a diagnosis, make sure to establish consent to manage finances. Again, I usually recommend as soon as someone is diagnosed with a dementia, if a power of attorney for healthcare and finances has not been done, it needs to be established. And it doesn't mean that as soon as someone has a dementia diagnosis that they can't make their decisions, but having a power of attorney already in place means that when they lose their capacity to make decisions, that power of attorney can take over immediately. And it's also important early in a disease diagnosis, start discussing the financial and estate planning. Again, there are elder law attorneys that specialize specifically just in older adults, working through estate planning, working through maybe long-term care needs, long-term care policies, and even considering Medicaid planning for future expenses. And then what do we do when someone is a victim of a scam? Whoop, sorry about that. So if somebody has made a payment, so they've used a wiring service, a credit card, PayPal, or another online payment app. If a payment's been made, report it to the payment source as soon as possible. See if it's possible for them to reverse the charge so that it's put back into your account. If someone has given out personal information, again, thinking about someone living with a cognitive impairment, If someone calls asking for specific information, I need your social security number, I need your checking account number, I need your birth date. If any information is given out, create new strong passwords. I would also think about making sure that you go to identitytheft.government, one, to report it, but also they'll identify next steps, maybe specific for a payment source that someone had used. If things like credit cards or debit card information has been given out, also think about contacting the bank or the credit card company, voiding that card and getting a new one. And then always report the fraud. The Federal Trade Commission does have a website where fraud can be reported. One, this helps them track how often it happens. It identifies any type of new scams, and they do a lot of education for people on what to do when they are a victim of a scam. Again, specific for what type of scam that they've fallen to. And then I won't go through all of this on the table, but these are kind of more specific about where you might have made a payment. So payment with credit card or debit card. Always contact the company or bank that issued the card. Tell them it was fraudulent, ask them to reverse the transaction. And oftentimes, if it's someone, if you can prove that it was a fraudulent activity, they can put the money back into the account. Again, an unauthorized transfer from a bank account, contact the bank, telling them that was an unauthorized debit or withdrawal. Many times they can reverse the transaction. Payment with gift cards are a lot more difficult. You can contact the company that issued the card. If you can tell them, if you have the gift card and the receipt, sometimes that will give them the ability to refund your money. But there are also some things that you specifically contact for maybe a wire transfer through a company like Western Union, payments through money transfer apps. A lot of older adults don't use cryptocurrency, and that's to their benefit because cryptocurrency payments are usually not reversible. So once you pay with a cryptocurrency, you can really only get your money back if the person you sent it to sends it back. And then payment with cash is usually put in to the US mail, put out in the mail to be sent to someone through the United States Postal Service. And there are numbers that you can contact for USPS for their inspection service. And oftentimes they can try to intercept the package. And then the last kind of objective on here was looking at the financial vulnerability that actually may be an early sign of Alzheimer's disease. So there were some interesting studies or interesting articles that came out since 2016 that actually looked at this. But in 2016, there was a large study that was published in the Journal of Alzheimer's Disease. And older adults who had a diagnosis of mild cognitive impairment were shown to be more susceptible to scams, especially those that underwent cognitive testing that showed slower processing speed and the lowest short-term memory scores on cognitive testing. This article was the first to identify that those with memory loss were more likely to misremember facts, but it was more difficult for them to discern a scam from a legitimate situation. And then in 2019, the American College of Physicians published a study that was looking at the hypothesis that low scam awareness was associated with an increased risk for dementia. So in this study, there was 935 patients in Chicago, and they were followed over 6 years for a fairly long time. And those people that ended up with a low scam awareness, they created a score. So the lower the score for their scam awareness, it showed that over those 6 years, those were the individuals that had the highest risk for developing Alzheimer's. And this low scam awareness, the score that they created for each 1 unit increase, there was an associated increased risk for dementia diagnoses by 60%. This article or this study from the American College of Physicians also looked at these people were followed in memory clinics. So they had actually undergone diagnostic testing for Alzheimer's. And those patients with the lowest scam awareness also had the highest disease burden or Alzheimer's pathology with amyloid beta plaques in the brain. And then in 2020, Johns Hopkins University did a study that was published in the Journal of American Medical Association Internal Medicine. And in this one, this was an analysis of 81,000 Medicare beneficiaries' health data. So it was a chart review of people who were followed over time who were later diagnosed with dementia. And what they were able to see or to show was that those who were diagnosed with dementia were more likely to experience drops in their credit scores and miss bill payments than those who were not later diagnosed with dementia. And probably the most interesting of the studies that looked at this, in 2024, there's a National Institute on Health funded study at the University of Southern California. And this study showed that older adults who were victims of financial scams had similar MRI findings of older adults who'd already been diagnosed with Alzheimer's disease. So of the regions of the brain that were studied, these are the regions that we worry most with development of Alzheimer's disease. Our hippocampus is considered the learning and memory center. The prefrontal cortex regulates emotion, motivation, and the entorhinal cortex is essentially the relay station between the two. So knowing that these areas of the brain are typically the most impacted early in the diagnosis of Alzheimer's, they were looking at the MRI findings for older adults who did not have a diagnosis of Alzheimer's, but who were also victims of financial scams. And then the researchers developed a standardized tool called a financial exploitation vulnerability, or an FEV. And so meaning that the higher the financial exploitation vulnerability, the higher an FEV score would be. And they found a pretty significant correlation that those who had these higher FEV scores, or those who were more vulnerable to financial scams, had a thinner entorhinal cortex, which is a finding with Alzheimer's disease as well. Previous research that had been done with this tool, the FEV, had also shown a link to these patients were more likely to have mild cognitive impairment. So this study was the first that really suggested that this FEV tool, this financial exploitation vulnerability, could potentially be a new clinical tool for detecting early cognitive changes in older adults. So with all of that information, does it mean that every person who's the victim of a financial scam does also have Alzheimer's disease? No, there are a lot of older adults who could be victims of scams, but if it's an individual where this is very atypical for them, that they might have been very frugal, self-identified tightwad, or miserly about their money, who now is seeming to give thousands of dollars to people that should not be trustworthy, that should be one of the warning signs that people identify that this is abnormal behavior. It's worthwhile to get a cognitive exam and screen for them. Then the last slide that I put on here, I think, were some more of the more important resources I thought for people to look at. AARP has a wealth of knowledge, free knowledge and free education they provide for older adults, for seniors. They have a great website on how to keep a loved one with cognitive decline safe from scams. The Federal Trade Commission, again, has a great education website, but it's also how to report a fraud. And then the NIH, or National Institute on Health, has a website dedicated to managing money problems for people with dementia. So some of those things that I mentioned about, how can we set up financial powers of attorney, putting spend accounts or overdraft protection onto accounts. Those are things that the NIH will also identify as well. I think that was my last slide. So thank you all for listening, and I'm happy to take any questions. I think you might be on mute.
I am. You think after 5 years we'd have this whole technology figured out. This is a very complicated topic, so any and all information is good information. It can be really challenging, I feel, for people to even know where to start, or just identifying what is something that should be reported or to kind of manage. So the information you just listed is extremely helpful just to know why this particular population is vulnerable. And all of us are. I mean, we're all guilty of it, and of falling victim to some of these scams, but especially if you have a cognitive issue. So thank you for laying out that information. So I do have one quick question. Can you put the last slide back for a few minutes, is what somebody said. If you're able to do that, perfect. And then I also have, in addition to that, I have some resources that I will put on the screen also. But we will be sharing the slide deck. I actually will get that from you, Dr. Hart, if that's okay with you. And then because there's some valuable resources on there. And then I also have some resources along with Erin's information that she shared. We will be sending that out to you all because there's so much information in there and such good information. I want to make sure you all have it. And again, when I say it's hard to know where to start, if you just have a general question of, is my loved one safe? What should I be doing? Start with your physician, your advanced practice provider, your medical office, or call Erin or anybody like that, just to at least start asking those questions. And then we can kind of help you along the way. So one question I do have on here, I've got a couple questions. Any strategies for folks experiencing cognitive impairment who refuse assistance from others? And this is when I say it can be tricky. This is what I mean. Yes, you're exactly right. So if you don't mind to, you and Erin to kind of maybe tag team that question.
I will definitely say it's different for different people too. I kind of went into memory disorders because I've had a strong family history of Alzheimer's. 3 of my 4 grandparents died of complications of Alzheimer's disease, and they all managed money very differently. I think depending on how maybe what someone's background is and how they have managed money or thought about it in the past is important. So for instance, like my granny grew up during the Depression, and she was someone who had 6 kids, was very, very frugal with money. If there was a deal at Kroger where you bought 5 things for the price of one, she brought 5 things for one, and you just ate it for 2 weeks because you were going to save money. So for her, I think it was really important for our family, especially, my mom and her sister, who kind of took over a lot with the finances, was to identify that things are getting really expensive. And now that dad's passed away, we have to keep the house for you. I think you would probably be more comfortable if we tried to help figure out a budget for you or how much money came in, came out each month. And that worked really well for her because it was focused on, you've spent all of this time saving money. We need to make sure we continue to save money for you. My other grandma was a little spitfire before she had dementia, and became even more so when she did get Alzheimer's. But it was, she and my grandpa used to be the caretakers for their church. And my aunt found out that she was getting money put into an account that was actually going into a checking account for the church. And instead of putting it into a savings account, she had almost $150,000 in this checking account. And I think for Memaw, she was one of those people, like, we sat down and kind of she had a family meeting with her 2 kids and showing, this is how much money that we need for the church. These are the bills. This is where it goes from. And Memaw very quickly became overwhelmed. And for her, it was, if we don't fix this, you're going to lose the ability, like the church is probably going to have to close. So for her, it ended up being a guilt trip, I think. But I think that's where it's kind of important to notice or to know a little bit about someone's personality and spending habits over a lifetime. I don't know if Erin had other suggestions or thoughts on that too.
Well, and I think it's something that you mentioned is like having that discussion in a private place with immediate family. I think is very important that you're not, in a way, they feel attacked. So really just talking about, and this is really hard. A lot of people come to us as like, well, what do I do if my loved one just doesn't want to go to the doctor or is just, I'm seeing the memory issues, but they're not. We often also talk about writing in a journal, like what are some of those dates and what are some of those circumstances, and then having that private discussion because 9 times out of 10, they're gonna be like, no, I didn't do that, right? And so you'll have some information to be able to back up that conversation. But I think it's really important to have it in an intimate setting. That way they don't feel like they're being, again, attacked in any way. And then making sure you have that power of attorney, because if it does get to that situation, then you do have control to, put those limits on those bank accounts. And maybe they don't know, maybe they have $200 they can spend a day, but they think they have 2,000, and some of that stuff can be internal between you and your family as well.
And I think it's important to share it, with your medical provider. But again, like you said, it's probably more of a, hey, this is happening, and then a private conversation with them instead of making that the focus of a visit, because I think it's already hard for an older adult to come in for a cognitive screening exam. They're very fearful of what those results are. So the more they feel attacked during then, it's probably not going to be a good memory if they can remember that conversation. So yes, identify it with a healthcare provider so that maybe education or resourcing can happen. But I agree, it needs to be kind of a private conversation with them.
And yes, I know lots of family members who are choosing to use like a third party person, if you will, to help facilitate that conversation. So whether you have a trusted family attorney or that trusted primary care physician or something of that nature, maybe having something along those lines. So great question. So is there, and I'm going to throw this out because I've been racking my brain on what families have told me they've used in the past, but is there a way to block the robocalls at all? Despite being on the do not call list, we know those aren't truly protective, but they seem to be increasing on a daily basis. Do you all had any feedback on anything that is really a tried and true
The only one
prevention
that
there?
I'm really aware of, and it's sometimes harder for older adults, is because a lot of them don't have smartphones, but iPhone and Android do have the ability that you can set to block a call unless it comes as it's, I think for my iPhone, it says, like so I'm in clinic all day. I have my phone on silent. I don't accept calls if I'm in the clinic space. Now, they can leave messages for me, but if my parents call during the workday, I know something is wrong, so I can have it set so that those will always go through. So you can silence some of them. There are ways, again, on a smartphone, if you get an unwanted call or message, you can have it blocked so that that phone number can't come through again. But outside of that, I know a lot of older adults still have landlines, and I'm not aware of anything that's a tried and true get off the robocall list for that.
Yeah.
If
Go
I'm
ahead,
not
Erin.
mistaken, I think there is a service through Google that can help monitor calls. And I'll look that up, Stephanie, and send that so that way it's with the
Okay.
resources.
Okay. It does. And it's sad that this is the approaches we have to take. We have to kind of think outside the box and try to trick these people who are quite clever, obviously, at accessing us. Another question, when is it time to take the phone away from a family member who struggles with all of these issues? My family member is tied to the phone for all kinds of reasons. When and how to take the phone away is a question.
And I think that one's going to be a difficult one and maybe kind of specific for families. I know a lot of families don't want a loved one not to have the ability to call in an emergency. But if they're on a phone, like a smartphone that has access to, they can get on the internet, and they can get on their cash sharing apps and things. They're easy access to lose things very quickly. Some family members will switch them to like a flip phone or something that doesn't really have internet access, but still has the ability to make and answer calls, leave voicemails, text messaging services. Um, and I think that, and I would agree, people need to have a way to access help. There are some things that you can do on a smartphone, like essentially kind of the same way that you would have with kids. You can set some things in place, like a VPN. You can put in you know, malware apps and things to try to filter out some of the phishing emails, but I don't think any of those are 100% safe. I think if a loved one is again determined, you like some of these examples that I mentioned, someone giving away $400,000 to someone on a social media slide, that's a large amount of money, and that individual really should be screened for a cognitive disorder. And if they are diagnosed with dementia, I think at that point, you really need to make a case with your medical provider about, does this patient have the capacity to make financial decisions? And if it's determined that their dementia is significant enough that no, they don't, it's kind of that same way of thinking about having a financial power of attorney in place so that when it gets to that point, the power of attorney makes the decisions. But if someone has dementia, has given out large amounts of money, I think that's the time when you need to take action with taking the phone away.
And I think there are certain protections you can put on a smartphone that they aren't able to access certain apps or certain websites and things like that. But also, you can think about just going back to old school and having that, a landline, because there's some protections on that too. And then that way they can't access the internet just through a landline.
Again, all very individualized, probably approaches, right? So what you said, Dr. Hart, about capacity actually is a good segue to the next question: is what does an evaluation look like where you would determine if somebody is safe or not, or able to make such decisions?
Ideally, they probably have someone that's addressing cognitive issues. Some primary care providers may know their patients for a very long time and have the ability to see them over the last 20 years with how they've changed. They know the family members. Sometimes a primary care physician who's known someone for a very long time can have a conversation about financial capacity or decision-making capacity. But unfortunately, a lot of primary care visits are very brief, and sometimes providers change, and 10 to 15 minutes is very difficult when you're trying to also manage blood pressure and diabetes. And hey, mom just spent $50,000 and I have no idea where it went. A lot of times I actually get referrals for that. And their first visit ends up being a new patient assessment, getting a history, doing a cognitive test, and 9 times out of 10, when they come in and we do cognitive testing, even on a screening test, their cognitive score is low enough to qualify them for a diagnosis of dementia. But I think if it's the first time that something has happened, maybe ask the primary care physician if they're not comfortable, can you send me on for a cognitive test or for someone to actually look at this? It would be appropriate.
Perfect. All right. I think that is it for questions. Erin, do you have any follow-up comments or tips?
Well, just know that this journey you don't have to do alone, and there's so much support in your community between the Alzheimer's Association. Norton does an incredible job, and I know sometimes it's hard to ask for help, but I promise you, there's different strategies and tips to help you navigate this disease, and that's what we're here for. We're here to help you, so please reach out if you ever need anything. And again, this isn't something you have to do alone. So.
Awesome. Dr. Hart, thank you so much for your time this morning. Good information as always. Erin, thank you for your support and collaboration as always. And again, we are going to send this information to you through the email that you registered, with which you registered. And then any follow-up questions, never hesitate to reach out to us. And we appreciate you all and look forward to seeing you at the next one, which is May 7th. So that will, again, will be Dr. Cooper. He will be talking about updates in the field of dementia. So in regards to treatments and prevention strategies, things of that nature. So look forward to seeing you all then, and feel free to spread the word, and we will see you next time. Thank you all.
Yeah.
Thanks. Thank you.